management of epistaxis. So any bleeding that occurs from the nose is known as epistaxis. So nose bleed equal to epistaxis, right? So कोई भी नोज ब्लीड लेके आता है, सबसे पहले तो हम फर्स्ट एड के रूप में या फर्स्ट इंटरवेंशन के रूप में, फर्स्ट एड बोलो, उसको बोलेंगे आप ट्रॉटर्स मेथड करो. व्हाट इज ट्रॉटर्स मेथड? एकदम सिंपल. पिंच योर नोज एंड बेंड फॉरवर्ड. पिंच योर नोज टाइटली, बेंड फॉरवर्ड. इसको ही कहते हैं ट्रॉटर्स मेथड. यू आर प्रेशराइजिंग योर नेजल कैविटी एंड बेंडिंग डाउन फॉरवर्ड. दिस टू प्लस can stop the bleeding, actually can stop the bleeding if minor epistaxis. So first aid क्या है कोई भी nasal bleed का? That is Trotter's method. So simple as that. You have to pinch your nostrils and you have to breathe through your mouth and seat and lean forward. Okay, you have to lean forward, pinch your nostril and lean forward. So automatically you have to breathe from your mouth only. So this is how you do it, Trotter's method. Okay, suppose even after Trotter's method the bleeding continues, then what you will do? If bleeding continues, then you have to do what? A ENT specialist will do nasal endoscopy and will try to cauterize the bleeding area. Okay, so again, first when someone comes with a nasal bleeding, you have to do Trotter's method. If Trotter's method fails, that is the bleeding continues, then what you have to do? You have to do nasal endoscopy and then cauterize the area. You have to cauterize the area, maybe chemical cauterization, maybe electrocauterization. So you can see this is the nasal endoscope, this is the suctioner being used, and also with this set they are giving passing electric signal so that they can cauterize the bleeding area. So this is how you do it. This is electrocauterization. So this is electrocauterization, this is the endoscope, this one. So suppose the bleeding still continues, bleeding still positive, then you have to admit the patient and also have to do what? Bilateral anterior nasal pack. So how does it look like? It looks like something. Suppose this is the nasal cavity, front view, back. You have to take a gauze piece and you have to roll it like this. This is how you do anterior nasal pack. You have to do it bilaterally and you have to just cover the nasal cavity, no roll of nasopharynx. The nasopharynx is kept open still. Okay, suppose still the bleeding continues, then you have to go for posterior nasal pack. But remember, posterior nasal pack is never done alone. It is always and always posterior nasal pack plus anterior nasal pack, which is bilateral. So what we are doing in posterior nasal pack is, first, this is nose, this is the pharynx. You have to put a catheter like structure or any ribbon structure like this. This is our mouth, this is the oropharynx. So through nasal cavity we have put a catheter like this and brought to the oropharynx, till oropharynx. Okay, now we have to take a gauze piece rolled in a shape of cone and tie three thread to it. 1, 2 and 3. Next step what we have to do is, we have to bring this tube out from our mouth. We have to bring this tube out from our mouth. Okay, we have brought this tube out from our mouth and then we will tie 2 ribbons, one here and one here. This one is left alone. So there were 3 threads. First tie, second tied, third is left free. Now what we will do? We will take out the tube like this. Take out the tube like this. So automatically this will be pulled. So automatically this will be pulled. So what is the scenario now? Scenario is that we are bringing this one and the tight object, something like this, is going through the mouth, through the oropharynx, and later reaching where? Reaching the nasopharynx, and 2 threads coming out of it from the nasal cavity and 1 thread coming out of the mouth. Okay, so this is posterior nasal packing, where we are actually blocking the posterior aspect of nasal cavity and nasopharynx. After this we will do anterior nasal packing. So we have covered the anterior part of the nasal cavity as well as the posterior part of the nasal cavity. So we have completely occluded the nasal cavity and part of nasopharynx. At least this satisfies the fact that all the bleeding areas, all the possible bleeding areas is now covered. In anterior nasal packing, there may be some bleeding areas still left in the posterior aspect of the nasal cavity or nasopharynx, which is not appreciated in anterior nasal packing. But when we do posterior nasal packing along with the anterior nasal packing, all the areas of bleeding are justified, are being addressed, right? So this is how you do posterior nasal packing. So these threads are kept so as the indication that it is in the place. We can pull it from here or we can pull it from here when we want to remove. When we want to remove, we can use this thread, or if we want to tighten up, we can use this one. If we want to tight this area, then we can pull this too. And if you want to remove, then we can pull the one which is from the oral cavity. So this is how you do it. So let's see a photo. So what they have done, they have put a catheter like this and brought it from the mouth. They tied the roll, this gauze piece roll, and then they have pulled the tube from the nasal cavity. They have put the tube from the nasal cavity and brought it from the mouth, and now they are pulling the tube from the nasal cavity so that the rolls now go inside the mouth, then oropharynx, then to the nasopharynx. See, this has blocked the nasopharynx and the posterior nasal area, posterior nasal cavity area. So bleeding from these sides are being addressed now. Okay, the tube has been removed. The only threads are being left alone like this. One thread here, two threads here. Now after posterior nasal packing is achieved, we do anterior nasal packing like this. And now we have addressed all the area, all the possible areas from where the nasal bleeding may be occurring. So that's why posterior and bilateral anterior nasal packing is always done together. Now suppose if still even after that bleeding is positive, then we have to go for vessel ligation. Now we have to directly look for the vessels and ligate them, block them. And the most common artery which causes epistaxis is sphenopalatine artery. So this has to be addressed first. If still bleeding is positive, then we can do maxillary artery ligation. First you have to do sphenopalatine ligation, which is the most common cause of epistaxis. If bleeding still continues, go for maxillary artery ligation. If bleeding still continues, then go for anterior ethmoidal. If bleeding still continues, last option is external carotid artery ligation. So this is the whole funda. Let us summarize again. First aid, TROTTER's method. Then go for endoscopic cauterization. If bleeding still continues, go for bilateral anterior nasal packing. If bleeding still continues, go for posterior nasal packing plus bilateral anterior nasal packing. If bleeding still continues, you have to go for vessel ligation. And the sequence is first sphenopalatine, then go for maxillary, then go for anterior ethmoidal, then go for last external carotid artery. So this is how you do it.